Morning, I'm Dr. Matt Belman, and I'm a veterinarian here at Pet Stop Vet Clinic. We've got a little patient named Spanky here. Spanky's here for a dental cleaning. He's a nice little dog, and we're going to kind of demonstrate a quick little examination on a dog, in case you haven't seen a veterinarian examine a dog. So Spanky's on the table, and he's well behaved, and we're checking his weight on the table. He's 19 pounds. It's important to check their weight so you can dose drugs and anesthesias correctly, and so we can follow up on their health care. Spanky's weight is good. And we examine their eyes, looking for redness or cataracts or other problems that can go on. Spanky's eyes look beautiful. We can see his retinas, and they're nice and clear. And then we have a look in his ears and make sure he doesn't have any ear infections or redness. If we're really worried, we'd put an otoscope cone on and we'd look way down in his ears. But right now, he's being a good boy. We can see that his ears look pretty clean. This ear has a little bit of wax in it, and we're going to go ahead and clean that out when he's asleep for his dental cleaning. Now we're going to look at his mouth and nose, look at his teeth. He's got a little plaque and gum disease. We're going to clean his teeth. Nice pink gums, no broken teeth. And look in his mouth, check his lymph nodes, make sure his collar fits appropriately, it's not too tight. We're going to look at his toenails. We can trim those when he's asleep. Feel his joints, make sure that he doesn't have any arthritis. Spanky's not very old, but some dogs will have joint problems, especially very active dogs or dogs that have been hit by cars and that sort of thing. And then we're going to listen to his heart. Make sure it's got a nice steady rhythm. And listen to both sides of his chest so we can hear the different parts of his heart for murmurs and arrhythmias. His heart sounds good. Listen to his lungs. Make sure there's no crackling or wheezing. And then work our way back. And if he'll stay still, Spanky will have a little feel of his stomach. Make sure his stomach's not gassy. Generally they relax. Make sure there are no abdominal enlargements, problems with his internal organs or urinary bladder. And then rotate his legs. Make sure his knees and hips are feeling normal. Good range of motion. No popping of his kneecaps or cartilage. That's all good, Spanky. And last but not least, check his little bottom. Make sure it's looking nice and clean and there are no growths there. And then if we can, have a look. Make sure he doesn't have any rashes on his belly or hair loss. And Spanky looks good. So now we're going to give him a little pre-anesthetic injection to help tranquilize him before he gets some general anesthesia. And that'll dry up some secretions in his mouth and sedate him, and then he'll be going to sleep and having his teeth cleaned in just a little bit. Bye-bye for now.